If prolonged airway management is likely, then the CFR Advanced provider may consider the use of non-inflatable supraglottic airway to help their resuscitation attempt. It must be noted that indications include apneic patients only FEC recommends the use of non-inflatable supraglottic airways for CFR Advanced providers only. Key components and their function. The soft non-inflatable gel-like cuff matches the shape and softness of the laryngeal and perilaryngeal framework. It helps to provide easy and rapid insertion and reduces the potential for trauma. An integral gastric channel is provided to reduce the risk of aspiration. The buccal cavity stabilizer eliminates the potential for rotation and aids insertion. An epiglottic rest helps to prevent the epiglottis from downfolding or obstructing the distal opening of the airway. The 15 mm connector extends inside the airway tube far enough to provide an integral bite block. Open the package on a flat surface. Take out the protective cradle or cage pack containing the device. Place a small bolus of a water-based lubricant onto the middle of the smooth surface of the cradle or cage. Do not use silicone-based lubricants. Grasp the device with the opposite free hand along the integral bite block and lubricate the back, sides, and front of the cuff with a thin layer of lubricant. This process may be repeated if lubrication is not adequate. After lubrication has been completed, check that no bolus of lubricant remains in the bowl of the cuff or elsewhere on the device. Avoid touching the cuff of the device with your hands. Place the device back in the protective cradle or cage pack in preparation for insertion. Do not place the device onto the pillow or chest of the patient. Always use the protective cradle or cage pack. Do not use unsterilized gauze to help in lubricating the device. Do not apply lubricant too long before insertion, and always ensure dentures or plates are removed from the mouth before attempting insertion. The device must always be separated from the protective cradle or cage pack prior to use. These are not introducers and must never be inserted into the patient's mouth. A proficient user can achieve insertion in less than 5 seconds. Remove the device from the protective cradle or cage pack. Grasp the lubricated device firmly along the integral bite block. Position the device so that the device cuff outlet is facing towards the chin of the patient. The patient should be in the sniffing the morning air position with the head extended and neck flexed. The chin should be gently pressed down before proceeding to insert. Introduce the leading soft tip into the mouth of the patient in a direction towards the hard palate. Glide the device downwards and backwards along the hard palate with a continuous but gentle push until a definitive resistance is felt. Do not apply excessive force on the device during insertion. It is not necessary to insert fingers or thumbs into the patient's mouth during the process of insertion. If there is early resistance during insertion, a jaw thrust or insertion with deep rotation is recommended. When inserted to a definitive resistance, the tip of the device should be located in the upper esophageal opening and the cuff should be located against the laryngeal framework. The incisor should be resting on the integral bite block. The device has a horizontal line on the integral bite block to indicate the optimal position of the teeth, but the teeth may rest safely anywhere in the integral bite block. The device should then be taped down maxilla to maxilla. When inserting the device, it should be remembered that partial resistance and then a feeling of give way may sometimes be felt before the endpoint resistance is met. This is due to the passage of the bowl of the device through the forcial pillars. This is quite normal and consistent with correct insertion, but in such cases, insertion needs to continue until definitive resistance is felt. Let's look at some device insertions in real patients. Note the sniffing the morning air position and the gentle press down on the chin. See how there is no need for fingers to be inserted into the mouth. There is never a need to apply excessive force or to repeatedly push down on the device once the definitive resistance has been felt. So, having watched the demonstration, it's now your turn to practice inserting a non-inflatable supraglottic airway.